One of the things that I've talked about with you is that there are oftentimes choices that are given to parents about how to support their children when they've had this diagnosis.
Right. So there's no way of seeing the CMN before birth. And so it's oftentimes a shock in the delivery room once baby arrives. People are seeing something that they're not familiar with and they don't know what it is. And that's often times also like a very urgent moment for the family.
Yeah, we kind of call it that lightning strike in the delivery room, because that's about the same. It feels like that's the same odds as being born with CMN. So that, kind of initial shock, and then a lot of times there isn't clear understanding. Obviously we're working to raise awareness with medical providers, but at the same time we do have pockets of places where a child is born with CMN and someone doesn't know what it is, and it takes a little bit to get diagnosis, but usually fairly right after birth you have a diagnosis, and connecting with a pediatric dermatologist is often the next step, and then at some point down the line you're sitting in rooms talking about how can we treat this, what are our treatment options, and as of right now, the majority of those treatment options are centered in surgical intervention.
Mm-hmm.
Mm-hmm.
And not knowing the future, right? We don't know the future. So we have no idea what the best thing to do is. And that's really hard too. It's almost like when there is not a choice, there's a little bit of like, well, there wasn't a choice. That's what I needed to do.
First, we want to like stand with families in the delivery room and in the room where they're getting their MRI, and like um, knowing that they're going to be okay, like no matter,
Mm-hmm.
even though that they feel overwhelmed with the decisions they're having to make in the moment, like there is a path forward, and wherever you land with those choices, that you have a community here that's going to support you.
Yes, I can imagine because again, having a lot of choices can sometimes be harder because you're like, what if I make this choice? What does it look like 5 years down the road? What does it look like in 1 month? What does it look like when my child's 40?